Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Derhake. In this video, we're going to talk about how to operate your CPM machine, or your continuous passive motion machine, following an ACL reconstruction. To help us do that today, I've enlisted Ashley Hackman from the Department of Physical Therapy. Thanks for being here, Ashley.
Thank you.
All right, let's get to the CPM machine.
Okay, first we're going to talk about the initial setup of the CPM machine. The first thing to take into account is that we want this on a nice flat supported surface. This can be done either in your bed or on the couch. If it's in bed, we like for you to have the affected leg towards the middle of the bed versus the outside. That way the machine doesn't inadvertently fall out of the bed with your leg strapped in it. Or you can have it on your couch. We want the machine up against the back of the couch. Next, we're going to talk about the power cord. The power cord plugs in right here into the machine, and then there's an on-off switch directly next to that. It does use a 3-prong cord, so if you live in an older home that is not adapted for that, you will need the adapter before plugging in the unit. So when you go to plug in the machine, you can either utilize the on-off switch or you can unplug it from the wall. So the basic machine, we get your leg in here. We're going to try to align your knee joint with these two big circles here. Your foot goes flat against the foot piece here. We like that foot to be in a nice neutral position, not tilted to one side or the other, straight up or down. Once your foot is in, we can bring this strap around to help hold your foot in place. And then this is an extra strap that you can either place around your shin or your thigh to help hold the leg in, and we'll talk about that in a few minutes. Now we're going to talk about placing your leg into the CPM machine. You will come out of your brace to come into the machine, and you will likely need help holding your leg to get it into position. We place your leg flat on the CPM. The knee should be aligned with these two circles when we previously fitted it for you. Your foot should be flat against the foot plate here. If the foot has pushed down or is not quite neutral, we can loosen these right here, and then we can bring that foot up nice into a neutral position and then tighten them back in. Once the foot is secure, we can bring this strap around to help position the foot. There's an extra strap that we can place either over the shin or at the thigh to help keep the leg in place. And it simply wraps around the machine and Velcros. Okay. Make sure the strap is nice and snug to help keep your leg in place and so that you're getting as much flexion as possible. Next, we're going to discuss adjusting the range of motion for the machine using the controller. The CPM range of motion will come preset for you at 0 degrees extension or knee straight and 40 degrees of flexion or knee bend. As previously discussed, we're going to do the machine for 4 hours a day, starting from 0 to 40, and then we will increase by 10 degrees each day. We'll push the menu button, push the knee bend button. You can see it's set on 40 now. That'll be your first day. On day 2, you need to increase by 10 degrees, so you simply push the up button until you get to 50. Throughout the course of your 4 hours on day 1, you can bump it up gradually to say like 43, 46, 48, things like that, so you're not making that dramatic jump from day to day. This straight knee bend, we always want that to be on 0, so you won't mess with that. Back to knee bend, and then you hit start. Now we're going to watch the CPM in action. Turn the machine on and watch it bend your knee. It will hold your knee for 10 seconds in extension. Then it's going to slowly bend you up to the degrees you have the machine set at. It's important that you just try to lay back and relax and let the machine do the bending for you. Once you get to the top, in this case we have it set at 60 degrees, it's going to hold you for 10 seconds in that flexed position before slowly returning you back to 0. There's not a timer on the machine, so you'll want to keep track of how much time you've spent in the machine. So remember, on the controller, we're simply going to hit start or stop, menu, to the bend knee, and then plus or minus. Dr. Derhake wants you to be in the machine for 4 hours a day. This can be done at 4 hours all at once, 2 2-hour sessions, 4 1-hour sessions, whatever works well for you.
I'd like to thank Ashley for going over the specifics of how you set up your CPM machine. As always, you have the backing of the Quincy Medical Group Department of Orthopedics as well as physical therapy. If you have any further questions regarding your CPM machine, don't hesitate to call. I hope you've enjoyed this video. Have a great day.